Hi everyone, welcome to the FutureDDS specialty series. My name's Nick Saber and I'm the current FutureDDS intern. I'm sure many of you have the same questions as I do when it comes into getting into a specialty program. So today we're going to answer those questions. For this episode, we have Dr. Buchanan, who's currently completing his pediatrics residency at UCSF. Dr. Buchanan, thank you for being here today.
Of course, thank you for having me. I feel so honored and grateful to be a part of this, so thank you.
We're lucky to have you. So, would you please just start off by giving us a brief summary about your background, like where you're from, where you went to undergrad, and where you went to dental school?
Absolutely. So I'm from South Bend, Indiana, born in the Midwest. I am a middle child, so I have an older sister and a younger brother. Growing up, so background information, neither one of my parents finished college. However, they did start, and they both were collegiate athletes. And so growing up, my parents always instilled in us the importance of an education and the importance of, having goals and setting goals and having, being basically knowing what you wanted to do, or whatever you wanted to do, they were going to be supportive either way, but just having a plan. And so in the 5th grade, my mom was diagnosed with multiple sclerosis. And that was sort of my first real encounter with an illness or just an ailment in my family. And so that sort of put into perspective, like, me taking care of someone. And so my mom had an aggressive course of multiple sclerosis, and it basically ate at her insides. And for people who are not very familiar with multiple sclerosis, is basically an autoimmune disease that eats away at the nerve sheets. And so these patients can't move as quickly. A lot of them sort of feel like these needle sticks in their body. Like, they just basically have like this tingleness around their body. They have memory issues, etc. And so I basically watched my mom go through this illness for a very long time. But starting at an early age, I was giving her medications. I was taking her to and from her medical visits. And that sort of put into me this sort of want to give back, this want to provide service, and this want to be a part of the health community, because I was around it at an early age. Mm-hmm. And I remember that my brother and I, at a young age, we made this pact, and we basically said that we would become doctors and we would find a cure for multiple sclerosis. And so at the time, that was sort of what I wanted to do. I thought I wanted to become a medical doctor so I could, basically cure multiple sclerosis. And it wasn't until I got to high school where I found this interest and love for dentistry. I had braces, and my orthodontist was like the coolest doctor ever. He had TVs and all the operatories. Every time we left, we got like this, either a shirt or a cool bracelet. It just was really interesting. He was also very educational as well. He taught me a lot about oral health and the importance of it. And then I also had a general dentist who also instilled in me like really great principles around oral health. And so I became really interested in dentistry around 15 or 16 years old. And then my grandmother also introduced me to her best friend, who is a dentist. And so basically that sort of turned my shifting in my interest of being a medical doctor to becoming a dentist. And so I went to college. I was a college athlete and majoring in psychology, and then also taking the science courses as a prerequisites on the side. And during my time in college, I was not the best student. Not that I didn't try hard. It was just very difficult for me to get a grasp of traveling every week for athletic events, and also making sure that I did my best in my science classes, biology, organic chemistry, physics, which are really challenging courses in themselves. And so I found it really difficult to devote 100% of my attention to those classes also while traveling for athletic events. And so I want to say by like junior year, I kind of knew that I would need to take some time off before I applied to dental school, just because I needed to raise my GPA. I say all that to say is that after graduation from undergrad, I graduated with maybe a 2.9 GPA.
Oh, wow.
And oh yeah, I was discouraged, and I was just like, there's no way that I'm going to be able to get into dental school with this GPA. I'm not competitive enough, even though I know deep down inside this is what I really want to do. And so after my undergrad, I applied to Masters of Public Health or public health programs to get a master's in public health, because I felt like if I can't become a dentist right now, I know that I ultimately still want to do healthcare. And so I felt like my interest in public health, or my entrance into the field of public health, would sort of give me the tools to still do what I wanted to do and make an impact in the field of healthcare. And so I got my master's in public health at Texas A&M University. And I should also take that back. I got my undergrad. I went to the University of Michigan and majored in psychology. And so afterwards, I went to Texas A&M, got my master's in public health. And in my last year, I did a project in India, and we were doing all these surveys and and at least in my head, I thought I was doing really good work. And I remember doing one survey with this group, and we were actually doing research in the slums of India, and on sanitation and water sources. And I remember saying, thank you so much for helping us with these surveys. Like, we really appreciate it. It's really gonna, be impactful and do all these wonderful things. And she looks at us and she says, for what? It's not like you guys are gonna do anything with this information. You guys get to go back home, and we are still here with these issues that really won't get fixed. Like, it's too big of an issue. And when she said that, I paused and I said, she's absolutely right. Like, I am here doing this project. I'm only here for a few weeks, and then I go home, and these people are still here in this situation. And it really made me take a lot of things into perspective. And I thought, I really need to figure out how I can make a bigger impact. And I'm one of those people that I like instant gratification. And so I really was like, well, I come in, I do my surveys, I go do my statistical analysis. And from those surveys, then maybe we can do something about it. And so once I got back from India, I started thinking, maybe it's time for me to start to figure out how I can get back into the field of dentistry, or getting into dental school. And so I graduated from my master's in public health in 2013, and I moved back home to Indiana. And I made a plan on figuring out how I could retake classes and take new classes to fulfill my prerequisites for dental school. Around this time, my mom was also getting very ill. So it was also a blessing to also be back at home. But around October of that same year, my mom ended up getting really sick to where we needed to make a decision on, is this going to be it for her? And so I remember at that time telling her, because I had time with her and speaking with her and saying, you know what? You spent most of your life being sick, and you could not reach a lot of the things that you wanted to reach. So I am going to make sure that I get into dental school. And so I basically made a pledge to myself during that time, is to not be discouraged, to have a little bit more confidence, and to do whatever it takes, because she couldn't reach her goals. And so I really felt like it would be unfair for me to have all of these resources out here and not take that step. And so basically I enrolled in some classes, I retook classes, and I ultimately applied to dental school. And I just kept my fingers crossed. And I said, I'm just gonna put myself out there. I graduated from my master's program with a 4.0. And so combining that with my 2.9 GPA in undergrad, and doing better in classes, I had a pretty decent GPA overall to apply. And so I ended up applying. I interviewed at Michigan, Indiana, Maryland, Louisville, University of Southern California. I think I got an interview at Ohio State, but I did not accept that interview because it was for the post-bac program and not automatically into the dental program. And so I interviewed at all these places, but I say all that to say is that, like, I went in not feeling confident. And I know there's a lot of students out there who are hesitant to apply because they feel like you need a 4.0 or you need a letter from the president as your recommendation letter. And, sometimes it just takes you just applying and putting yourself out there and seeing that you have what it takes. Like, if you're passionate and you're interested in doing it, you can do it. And so I ultimately accepted the offer. I got into Michigan, Indiana, Maryland, and I got waitlisted at Louisville and waitlisted at University of Southern California. And I ultimately took the offer from Michigan, even though it was out of state for me, but I felt like that was the best decision for me. And ended up enjoying it, loving it, and ultimately applied to pediatrics, and I'm at UCSF right now.
That's awesome. So
That was a long story.
no. I think that was great. That gave a lot of perspective for us, and I'm sure a lot of our viewers, like you said, they don't have like the perfect scores and all that, so they're looking for ways to follow their dreams of going to dental school. So thank you so much for that description. So when did you realize that you wanted to go into pediatrics though? Was that in dental school, like during like a rotation, or what happened there?
It was. I would say I was a late bloomer in that I didn't think about specializing until like third year of dental school. A lot of students come into dental school or a professional program and they are not dead set on what they want to do, but they sort of have an idea.
Right.
When I entered dental school, I was like, you know what? I've done undergrad. I took time off. I've done a master's. I just want to get out. Like, I think I just want to do general dentistry. And so while I was in dental school, I was really just focused on learning what I could, getting out and working. And it wasn't until maybe third year of dental school that I started entertaining the idea of specializing. And I should also tell you that like I was not planning on specializing. And so I started entertaining this idea like, well, maybe I could think about this. And I also hated making dentures. So I knew that if I decided to do general dentistry, that would be something that I would have to become proficient in. Right. I just did not like dentures at all. But I knew that I liked kids. I grew up babysitting. I've always had an interest with working with kids. I'm a big kid myself. So I was like, oh, well, maybe I should look into pediatrics. And I hadn't had my pediatric rotation yet. And so I had my pediatric rotation. I was really nervous about it because I think the one thing that I was so scared about was if I have a crying kid in my chair, will I be equipped or would I be comfortable enough to treat this kid? Right. And I let our department know that I was interested in pediatrics before I got in my rotation, just so that they would know. And that they also gave me a little bit more of the challenging cases. Yeah, I was appreciative about. And I'll never forget, I had like a 5-year-old who came in and she had fallen at the playground and hit her 2 front central incisors, number E and F. And I went to brush her teeth and she freaked out. And I was like, oh, I was fine. I said, okay, like I expected her. I expected behavior from her. She is 5 years old. She's in pain. I'm a complete stranger. And you know what? I took a step back. And at that point, I worked with her. I tried to build better rapport. But it didn't scare me away. And so basically after that, I knew that, I really wanted to do pediatrics.
Wow. So you had like one case basically, and that at that point you were like, this is for me.
At that point I realized, because I think that it was just the fact that I was so nervous about a kid crying that would scare me away. And so after I got through that and I knew that like, okay, like this wasn't very bad, I think I could do this. For the rest of the rotation, I was completely fine. And it really solidified, I think, that interest in me to want to do pediatrics. I was like, okay, I think I can do this.
So what kind of skills do you think are required to go into pediatrics? I'm sure like you have to like kids, right?
I think that's like, that's a must. I'm sure some people out there may like not, but I think that's a must. And I think that it's also, you have to know how to communicate with kids, right? and sort of sometimes come to their level, or a lot of times come to their level, like with vocabulary. Like I never say we're gonna do a shot. Like it's always we're gonna give you sleepy juice. I think that having an interest in working with kids, having a passion for working with kids, having communication skills to work with parents as well, I think that's sometimes missed at the same time.
Because the parents are your patients as well, basically, right?
Absolutely. Like if you can't, sometimes it comes to the point where if you can sell it to the parent, you're good to go. So I think also being able to interact with parents, being able to educate parents, especially parents who come in with infants, being able to educate them on proper dietary things for their kids, as far as like drinking from a bottle and giving their kids bottles when they're sleeping, and with milk or juice in it, and or the nutritional values of certain things, and making sure they're brushing their kids' teeth. So being able to communicate to that to them as well. But I think just having like a fun personality, and being really eager to have fun at work, and to make sure that you are making it a really good experience for these kids. Because a lot of kids, once they come to us as pediatric dental specialists, it's like at the last road for them. Like either they've been to a general dentist and it didn't go well, and so now they're getting referred to us because we're specialized in working with them. And so really being able to be a psychologist, a coach, a mentor, for these kids when they come and see you, I think that those are really good skills to have.
Yeah, it seems like the experiences that you described earlier, like they're perfect for this. You're an athlete, you babysat, like you've gone through a lot of stuff in your life, so you were ready for this. Like that's really cool. So do you think like these skills are like you need to be a natural and you need to have these skills, or do you think it's possible to like develop them as you go? Like let's say you know you like kids but you're not patient, for example. Can you go into pediatrics and then develop that patience over time, or would you not recommend that?
Yeah, I think that it would be great for someone who has the innate ability, right? But I mean, let's be realistic. I always believe in, if you can work on something, you can achieve that. So if there's a person out there that, one, you have to know that you're impatient. If you know that that's something that you're not, if you know that you're impatient, I would say work on those skills before you get there. Or the fact that you even know that that's something that you need to work on, I think that's a big deal in itself. But I would say making sure that you work on those skills that you know you're not at. I mean, I'm sure there are plenty of impatient pediatric dentists out there. And also that may come in handy, because when you're working with kids, you have to be quick. A kid's attention span is this big, not very big at all. So you have to be very quick at working with kids, where that impatience may come in handy. However, there may be a lot of kids, or even a lot of special needs children, who need a little bit longer time, to where you have to be patient with them, and it's not going to happen within 5 minutes. So I would say it just depends. Not everyone's the same, and so there are things that I may see that may work for me for being a pediatric dentist that may not work for others, but there are certain things that they may have as qualities that I may not have that may work very well for them. So I would say it just depends, and those, there are definitely things that you can work on once you get into the field.
So, and when you decided to become a pediatric specialist, did you speak to any like veteran specialists and see what they thought about that specialty, and if the job like wears them down, you know?
Correct.
Did you do any of that?
I did. I think that it's really important to do your research before you embark on anything. And I did that before undergrad. When I was looking at colleges, I did that before dental school. I did it especially when I was looking for specialties, because you want to make sure that whatever you're doing, you have a lot of information on it before you embark on that. And that it's a right fit for you. I don't want anyone to go into something where they waste their time. However, at the same time, I know that a lot of people want to do things to get a feel for it, because life is short at the same time. But I think that it's really important to use your resources. I reached out to mentors of mine. I reached out to other dental students, or other students who were in residency programs, or students who were in dental school that were applying to residency. Like, what did you do to get to apply to these programs? What types of things did you read or study or look at in order to prepare you for specialty, or to prepare you for that journey? I looked at a lot of student doctor network to look at those fields, those sort of the specialty links in those, what students were applying to, what programs, what they were talking about, what they were saying about certain programs. Yeah, I definitely think that looking into programs is really informational, and it should be done. And I definitely took advantage of my mentors and resources.
That's great. So you decided you want to go into pediatrics. How do you prepare for that? Do you need to go? Do you have to take any exams for, like, what's the application process like?
So I would say the process is sort of like applying to dental school. So it's a central application where you apply to all of the programs. What I did in order to prepare, so some of the things that when you get into dental school, you have certain organizations. So you'll have a pediatric dental organization, you have orthodontics organization, oral and maxillofacial surgeon organizations. So I would say for any students that are interested in specializing once you get into dental school, join those organizations so that you can get more information. And a lot of those organizations hold lunch and learns, or they have speakers come and speak with them about the specialty, or what it takes to apply, or students that have already applied. We have panels, etc. So I would say that that was the first step for me. I also did a lot of community service, working with kids, outreach events. I also volunteered for Big Brothers Big Sisters to get a little bit more experience with working with kids, but I also have like this passion for mentoring as well, so that just also played in well for me. And then I also
sorry, excuse me, was this before or after you decided you wanted to go into pediatrics?
This was interesting. So actually, I volunteered with Big Brothers Big Sisters before I even knew that I wanted to go into pediatrics, which was so like looking back at that, I'm so glad you brought that. Looking back at that, I'm like, wow, like, I was already on the path and didn't even really know it. Right. And then like when I thought about it, I was like, oh, like you already enjoy working with kids. Like just go ahead and do it. And you can see my back. I don't know if they can see my back.
Yeah, they'll see it.
Obviously, I'm a big kid and I love SpongeBob too. But I was already doing the Big Brothers Big Sisters. And so once you become a fourth year in dental school, that's when like the application cycle opens up. And it usually opens up the summer before, or the summer of or before your fourth year. And so you basically do the central app, you're getting recommendations in there, you're putting your transcript, etc. And then you send it out to these programs. And then that's when they reply and you have to interview. And so they'll send you interviews, and then you have to go on your interviews, and then it's a match process.
Okay, it's a match.
They do have non-match programs as well, but I mostly did match programs, and then you apply. The programs that you interview at, you rank them, and then once you rank them, they rank you, and then match day comes, and then you match somewhere.
Awesome. And you ended up at UCSF.
I ended up at UCSF, which was great. And I was looking for I really was like, I want to be in a bigger city. I want better weather. I was over the snow. And I was like, residency is 2 or 3 years. Try something new. Go to a different place. I'm all about living in different areas, and see if you like it. And if not, you can always go back to wherever you want to go.
That's true. I mean, what do you think of San Francisco so far? Do you like it?
It's expensive. Coming from the Midwest, it's expensive. But I really enjoy the weather out here. I enjoy having more things to do, whether that's a concert or a festival. I mean, obviously not during COVID, that unfortunately not happening. But it's really nice to have that at the tip of my fingertips if I wanted to do something.
Absolutely. So, first of all, how long is your residency, and do they vary with like other schools or universities?
Correct. So my residency is 3 years. It's one of the longest residencies out. UNC is also 3 years. Most programs are 2 years, with the exception of a couple of programs. I know Michigan's is 2.5, but most programs are 2. My program is 3, and the only really real difference between my program, other than the difference in the length of the duration of the program, is just that we take our time a little bit. So it's not like we stuff everything into 2 years. Right. So yeah, I really wanted a program with good work-life balance. I did not mind a 3-year program, and I didn't mind living for 3 years in San Francisco. So yeah, that was one of the things. And I also was just looking for something new. And I felt like I've never lived in California before. Let's try it out. And here I am. Yeah, enjoying it.
Awesome. And so can you describe like a typical day in your life as a pediatrics resident? Like what kind of patients do you see, and obviously kids, but and what kind of procedures do you perform? So one thing that I was wondering, like, do pediatric specialists, do they do anything specifically new, or are they just applying the things they learned in dental school to kids?
So I'll start and say that when we graduate from dental school, our curriculum on pediatrics is not very, it's not very in-depth. I mean, we do a rotation, but you're mostly seeing really good kids on those rotations. You really don't have to do a ton of behavioral management. At least in my dental school, I mean, you may have done a little bit of behavioral management, but not as much. And so I would say if I was just coming out of dental school, I don't feel like I would be equipped to deal with or work with kids that need or were behaviorally challenged or special needs children, for example, or working in the OR with special needs children or and children in general. So I feel like, you know, once to do a specialty, you learn about the guidelines for pediatric dentistry in general. You learn how to become proficient in sedation, which is what you would not, you have to do a program or a certificate in pediatric dentistry to get that certification in sedation. And so these are things that you would not have if you just came out of dental school. Although I will say that there are a lot of people out there who come out of dental school and can definitely go and work in pediatric clinic or pediatric dental clinic and do and see kids. They just would not be pediatric dentists. They would just be a general dentist working with kids. And so you can definitely get experience from that and go to CE courses and do all of that. You just would not have that certification and you would not have the specialty. So on a day-to-day basis, we are, as far as my residency program goes, at least in first year, we are doing a lot of exams. We're doing a lot of ops. We're in clinic every single day. My program is also unique in that we do orthodontics as well. So we do interceptive orthodontics. So that's like space maintainers. And we also do fixed appliances for braces and fixing cross bites and open bites and making tongue cribs for kids who suck their thumbs and have open bites now. We do a lot of that as well. We also make our own appliances for like retainers and stuff like that as well. We make all of our appliances. So that's unique. We do SSCs, which are stainless steel crowns. I do a lot of pulpotomies, which is like a half root canal. We do work in the OR. We see a lot of special needs children that range from Down syndrome, Apert syndrome, which is a part of the craniofacial syndrome list. We see a lot of kids with cerebral palsy, which is, so that's one of the big things as well. When you're in pediatric residency, you see a lot of special needs children. And so a lot of general dentists or a lot of dentists are not comfortable with seeing a lot of special needs children because of their complex medical history. And so coming out of a residency or a specialty, you get comfortable with treating these kids that a lot of dentists who normally would not feel comfortable seeing.
And at UCSF, how do they train you to become comfortable and like understand, you know, their perspective? Do you take courses or do you learn it like on the job?
A little bit of both. So yes and yes. We also take some classes. We do a lot of literature reviews. So we read a lot of literature on what's out there now, what are the guidelines, and then also just being in action, seeing these kids in action and learning right on the spot. And so that's like I learn really well on the spot and like actually doing it, like seeing it through versus reading it, because that way I'm like, oh, so that's what they meant when they were saying this in words. Like I can actually see it now. So I think like it's a little bit of both. But we do a lot. We see a lot of patients. We see a lot of patients.
So have you what have you learned like on the job that you find like to be a really valuable skill that you can apply to other parts of your life, if there are any?
Yes, I think the biggest part for me is the behavioral management aspect. As I said before, I have a background in psychology, so like that was one of the really big things as well, is that like I'm really interested in like working with kids and sort of altering their mindset of what they think about the dentist, and that I want like my patients to say, oh, that wasn't so bad. Like it wasn't a bad experience for me. Or like when kids come in, they're extremely like fearful of us, and they come in and they have a wonderful experience. And so I'm really interested in changing that mindset of kids. So that's like one of the major things for me. And then I'm trying to think of what else. The behavioral management, I think that would probably be the biggest thing for me.
And that's still a huge skill to acquire. So
I can use it on myself too. Like I can be like, okay, calm down, you got this, take deep breaths. That you can utilize. Yeah, I think those are aspects that you can utilize for my patients. I can utilize them for myself, for other people. It'll be great.
That's an awesome attitude to have. So another question I had for you was, how does residency compare to dental school? And you mentioned that the duration of this residency is only 3 years rather than 2, so you have a lot more time. Is it a little bit more relaxed than dental school?
Absolutely. You could not pay me to go back to dental school. Although I loved like seeing my friends, like dental school was very challenging. It's just a lot. It's a lot. It's overwhelming. You're studying a lot. It's a hard time.
Hmm.
Now, like I said, I wouldn't go back through it, but I'm very grateful for like the education that I received and the experience and the clinical experiences that I received. But residency, on the other hand, is a lot different in that you're treated like a doctor. Like I go in, we work at also one of our sites that we work at is a federally qualified healthcare center, and it's basically like private practice. And we work there. We have the assistants taking our radiographs for us. They come in and get us when the patient is seated, and it's great. Like I walk in like I'm the actual doctor, which is I am, but it's just nice as polarizing from dental school. It's nice to actually be the doctor and to basically be making these decisions. And so that's the really cool thing about the specialty is that you are a dentist at that point, and you're treated as a peer.
Hmm. And do you feel like you have more time? Like I'm sure dental students, like they're always busy. Whenever I talk to them, they have a million things on their plate. So what's it like as a specialist? Do you have more time to like relax? Is it more like just having a job, or are you still like in that, almost stressed state?
I would say it's a little bit of both for me. There are some times where I don't have a lot of work to do. I would also say that we also have to do research in our program. And so there are certain times where I'm busy with research or I'm busy with presentations for residency on things that I need to present on, whether that's a treatment plan or a presentation on a syndrome for the residents. So there are certain times where I'm more busier than others. And there are some times where it's just like work where I go in I'm there at 8, I leave at by 5:30, and I go home and I don't really have that much to do. But I could definitely be doing more and studying and looking up things and reading more so that way I can be better prepared for clinic and just making sure that I stay up on everything I need to stay up on.
Awesome. And so generally, like you enjoy this more than dental school, I
I
assume.
do. I do. Yeah, I think that it's just the culmination of the work-life balance that is really good for me. And then also like, I thrive more when the weather is nice and the sun is out. So I think like having the sun is really important for me too.
Hmm. Okay, so we're rounding the corner, we're reaching the last section. So last thing I want to know is how come I mean I'm pretty sure pediatrics is a really competitive specialty. Even people that have never shadowed a pediatric specialist, they're always saying I want to go into pediatrics. So and that's just those are pre-dental students. So I'm assuming like once you're in dental school, you get way more people who are interested in that, right?
Yeah. I want to say, so I graduated in a class of 120-ish students, and about maybe 10 of us were interested in pediatric dentistry.
And that's
I
a lot.
want
That's a
to,
lot, right? For
I
just
think that, yeah, and I want to say like that's usually the average. It's usually between 10 and 15 per class at least that I think that I know of. It maybe sometimes less than that.
Mhm.
But yeah, it's really competitive. Like a lot of programs, some programs accept 2 residents, some programs accept 5 or 6. Like my program is 5. A couple of programs are bigger, like USC's. They match 12 residents, I believe.
Whoa.
But it really depends on what program you're applying to. So, but it's still really competitive. It's still really competitive.
And so, what factors do you think can make you stand out as an applicant? So, you went to Michigan. I mean, obviously, the name is there. That's a really reputable school. But they're not pass fail, right?
Correct. So Michigan is not pass fail, although I wish it was. That would have been fantastic. So we definitely had grades. We have a GPA. We have a ranking system. Um, I think that some of the qualities that they look for are passionate. You're passionate. Are you passionate about working with kids? Does your resume or CV say that you're passionate about working with kids?
Hmm.
For example, like if you're applying to pediatric dentistry and you have not even done give kids a smile or mentored children or gone to talk to like just making sure that it makes sense as far as what it looks like on paper, and then also the grades. Are you competitive in your class wise? Although sometimes that doesn't matter as much, but that is one of the qualities that they look for are good grades. Your letters of recommendation. What are your professors and mentors saying about you as well? And then once you interview, they can also see that passion. Are you a good team player? Are you going to be a good fit for our program? Are you going to be flexible? That's one of the things that they look for when they're interviewing applicants are, if we need you to see this patient instead and see this patient, are you going to be able to just switch and do that? And also working in pediatrics, you never know, like a kid can flip like that. So you really have to make sure that you're flexible and really open to just being a team player and working well with others as well at the same time.
And how did you feel during that application process? Like, were you stressed about, matching with the program, or like, were you kind of like confident that you could get in somewhere?
I was not confident at all. And I know I stressed earlier about confidence and throwing yourself out there, but I like tossed and turned for at least weeks before I sent in my application, because I was like, is this the right thing? Like, should I put myself out there? Am I competitive enough? Do I want to get rejected? All questions that like I had no control over, right? Because when you send your, like, once I send my application in there, it's in their hands. And so I was not confident. I was very hesitant on putting myself out there. But I also knew that, like, okay, if I don't match, I go and work and make six figures, or work as a general dentist and still make an impact. So it really wasn't like life or death. It was just, do I want to put myself through this for self-care purposes? And so basically I applied and I let it go. And once I applied, I was just like, okay, what's in there? I don't stress about it. And so eventually I got some interviews and that raised my confidence, but initially it was not there.
I paid off. Like, you went through with it, and it rewarded you. So I'm happy, because just based off this interview, I'm like, I'm so happy that kids get to see you as their specialist. Like, that's awesome.
I appreciate that. I really do. And like, that means a lot, because, it's difficult. Like, once you get into dental school and then you get to go through specialty, it's nice that even when like my patients say like, thank you, it's like, okay, like you realize that it's difficult. I'm like, yes, I want to make sure I'm doing the best for you, but I also it's nice to be recognized as like, you're doing a good job, because I wake up every morning and it's like, I know I strive to do a good job. So I appreciate
You definitely deserve that recognition. It's a ton of work to go through that whole process. So honestly, really, congratulations for getting to the point that you are right now. And so last question that I have for you is, as a pre-dent, let's say, I don't know if pediatrics is for me, or if there are pre-dents that know they want to go into it. What can a pre-dent do right now to prepare for that specialty and, just increase their chances starting from now?
I would say first do your research. Talk to others who are either pediatric dentists, go and shadow them. That's one of the best ways to get a feel for something too, shadowing. I would also ask them tons of questions. Get to know dental students who are also interested in pediatrics and what they did as well. I would babysit, I would mentor, go read to kids at their classrooms, volunteer with anything that has to do with kids to get a feel for working with kids. And as we all know, all kids are different. No kid is the same, but at least getting a feel for being around kids and being comfortable with being around kids. That's the last thing you want to do, is work with kids and not be comfortable with kids. So I would say get to a place where you're comfortable with working with kids, and asking questions of mentors who are pediatric dentists or specialists who can assist you with that. And even if you're thinking about other specialty, do the same thing. Reach out to specialists and ask them questions. I hope that I can also leave my email.
Yeah,
so that way students, perfect. So that way students can reach out to me, utilize me as well. And if there's a question that I don't know that I can answer, for any students who are interested, I can find someone who can help out.
That's awesome. Yeah, that's awesome advice. Like, I really appreciate that. So that'll be it for this episode, everyone. But Dr. Buchanan, if our followers have any questions for you, is there any way they can reach out? You mentioned email. Is it okay if we leave that in the description for them to email you?
Absolutely. I'll put my email down. I also have Instagram at cbtwo, cb2. Yes, please hit me up, send me a message, and I'll try my best to get back with you and answer any questions that you guys may have about pediatric dentistry or dental school, etc.
That's so kind of you, and we'll be sure to include all that in the description. So everyone, if you haven't already, make sure to hit that like and subscribe button, and if you want to be notified when we post new content, make sure to hit the notification bell. If you have any questions for us at FutureDDS, you can DM us at _FutureDDS, and we'll try to respond to you as soon as possible. And until then, we'll see you all next time.